Hello. So for our knee assignment, I saw a mock patient because we didn't have our knees were actually going to be coming in the week of Thanksgiving, so I was unfortunately unable to um, assess any of them. They were on the volleyball team. So Kayla was my mock patient for a soccer player. And so just a little bit of background. She was a soccer player. She came in after a game, planted and twisted, kind of felt a pop, had some knee pain anteriorly, felt unstable, was favoring her right knee, and there was some popping or clicking. So there was my first thought obviously was ACL tear. Did Lockman's anterior drawer, both came up positive. McMurray's was also positive with some discomfort. So there could be some other involvement. So for question 1, was my evaluation comprehensive? Why or why not? So when it came to completing range of motions, muscle testing, and functional assessments, I tried to do a really good job with remembering to go bilaterally. I think that's a common habit of mine to just focus on the one side and not do the other. So I really tried to remember to, when I'm testing the good side, I'm also testing the bad side to see what their normal is. I think I did a pretty good job with that one. I assessed flexion, extension, internal, external rotation bilaterally. I did the muscle testing, the active range and passive range of motion. So I think for my evaluation, in a sense, I felt like I did a lot better job than I have done in the past. Question 2 was, did my palpations, inspection, and objective measurements lead to a confident diagnosis? So when I originally started palpating, I kind of didn't want to put myself in a box. So I started off with the patellar tendon and quad tendon and the patella, just work my way from the patella and work my way up and down, just to make sure that there wasn't any other involvement. Because again, like in class, we talked about how things can present differently. So I just wanted to keep that in the back of my mind. So as I was palpating around, I found some tenderness around the MCL, around that joint line. So again, I think because there was some laxity when I also did the varus and valgus stress test, or the valgus stress test, there was some laxity with the MCL. So I think there was probably involvement there. Did I incorporate evidence into my evaluation? Why or why not? So yes, so when I did my evidence, so when my anterior drawer, Lockman's, valgus, and varus, I think those 4 tests really kind of solidified my diagnosis in terms of ACL involvement, and also some laxity, because again, my goal was to do these tests I did these tests also bilaterally, just to make sure that I hit all of my my landmarks, and making sure that maybe if I did the valgus and varus stress testing, that I was also testing bilaterally, to see if there was any other hypermobility that was just present within the athlete. And I think doing those other tests really helped with my diagnosis. What did I do well? Discuss 2 areas. Well, I think I did a really good job with, again, the history taking. I also did, before this one, on Tuesday, I did 2 other evaluations. I did a shoulder evaluation and then a hip evaluation. And I felt like my really strong suit was, the history taking and kind of identifying kind of where the area of injury is, whether that being the MOI or it being from overuse. I think that's one of my strong suits, is just that history portion, getting the right information. And I think I really did well was remembering to test bilaterally. That was something that I really wanted to focus on in this, and I felt like I did a good job with it. What areas of improvement can I do? I still want to, again, I know I've talked about this portion a lot, but I tend to always forget about it, but I always want to try to focus myself on testing everything bilaterally when it comes to range of motion or some special tests. Surprisingly, there were some special tests that I just forgot the name to. It happened with my hip evaluation as well, where I remembered how to do it, I just forgot the name of it. So I want to try to do a better job of, remembering the name to the special test, so I can remember what the special test, like what I'm special testing for. Because I think that information is really important, so personally. But after discussing with my preceptor, we discussed, using the MOI for an ACL is understanding that yes, it can present as alternatives like we've talked about in class when you have anterior knee pain, but the history taking is the big differentiator to help you with your diagnosis, because again, special tests are to help, cross out diagnoses when you have such a broad, like, I have anterior knee pain. Okay, what does that mean, or how does that present? So just knowing how to work your way through that, because again, you don't need to have a concrete diagnosis when you get done with the range of motion or special testing, or not special testing, I'm sorry, range of motion and history taking. The special testing is just to help with like crossing those things out. So yeah.